Dr. Drew Taft, and this is another Fast Foot Fact. So we're finishing our video series on neuromas, and we'll finish off these series with some information about how we treat neuromas. Okay, so majority of the treatment for neuromas is definitely conservative therapy. Most people respond very, very well to conservative management. Certainly there are a small percentage of people who do go on to surgical treatments, and we can talk about that as well. But basically our treatment revolves around a couple different aspects. The first is managing the pain, which is again a result of the inflammation. So we treat inflammation with things like icing, sometimes anti-inflammatories. In some cases we'll do steroids. Steroids can be done orally, or like we mentioned in the last video, sometimes we will do steroid injections. And again, they can be diagnostic, and that they can help us to identify that we are treating the right area, but they are definitely also therapeutic. We get people who will get a steroid injection, and that oftentimes will alleviate a lot of the symptoms, or sometimes even all of the symptoms. So we're treating inflammation with those things, but we also have to really identify that the big reason why people developing this neuroma is mechanical. So it is how you're walking, it's how you're standing, it's your foot type, it's your mechanics that is causing those metatarsals to move in a certain way where the nerve is getting pinched. So another big way that we manage these neuromas is mechanically. So mechanically, one of them is shoe gear. Again, very important that we're giving that forefoot enough width. So we want to make sure that shoes have a good wide toe box. Depth can also be important as well, but giving that forefoot plenty of room to spread out when you're walking and standing is a big one. But another big thing that we'll do for neuromas are introducing an orthotic or an arch support. So orthotics can do a couple of things by just adding the support into the shoe. Having that nice arch contour helps to redistribute the forces on the ball of the foot more evenly. So it takes some of the pressure off of that forefoot, which can help to alleviate some of the load up top. But oftentimes we'll make some adjustments or modifications or additions to those orthotics that can also target that forefoot to really try to offload that particular forefoot area. And again, we did talk about cortisone injections and managing the inflammation. So it's a combination of the mechanical side and treating the inflammatory aspect of it that is usually pretty successful for treating neuromas. They don't go away overnight. They do typically take a few weeks, sometimes a few months for them to disappear. Some people will get majority of their symptoms controlled, and there may be activities or shoe gear that they wear, and it may trigger the symptoms again, but as long as they pay attention, they're able to keep things under control. And then again, in the small percentage of cases that does go on to surgical intervention, there are a couple of different ways that we do manage neuromas surgically. One of them is actually going in there and removing the really inflamed, swollen nerve. But we do have other methods of going in there and removing some of the scar tissue around the nerve, releasing some of the tight ligaments around the nerve as well to give them more space. So there's a couple of different approaches we have for neuromas surgically. But again, majority of these people do very well from a conservative standpoint. So, all right, that's it. That's neuromas. Obviously, if you have any questions, we encourage you to call. Thanks for listening, and we'll talk and be in touch soon with more videos. Thanks.